Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
I'm WVUA 23's Ashley Berry, and this is Health Matters. Today I am here with Katherine Moore, who is a Master Level Social Worker and the coordinator for the Medication Assistance Program at University Medical Center. Thanks for being here, Katherine.
Of course, yes.
Can you just break down what the Medication Assistance Program is and how it's really working to help patients?
Yeah, so I'm the director of our Medication Assistance Program, and kind of what that means is that we get referrals from different providers for patients' need for medication. It might be that we're going to visit a patient in their appointment, or it might be that they're sent to our social work intake office to just kind of go over the list of their medications that they're being prescribed. We typically go through the list of their medications, and we try to connect them with drug manufacturing companies that offer patient assistance programs. Several patients that we see are diabetic patients, and some of those medications can be very costly. So if it's something that we can do to help reduce the cost of those medications, and those patients can allocate the money that they would have previously spent on their prescriptions towards, utility bills or, some other need like that, we'd love to help them, be connected with those programs to help them just get their medication.
Yeah, and you mentioned diabetic patients. What are some of the most common medications or conditions that you see day to day?
Yeah, I feel like 100% diabetes is the most prevalent thing that we see day in, day out. I would say probably around 75 or 80% of the patients we help get medication assistance are diabetic patients. We help connect patients with a lot of insulin programs, things like Lantus and Humalog, Humulin, lots of different insulins. It's a lot of what we work with and see. But we might not know of all the patient assistance programs out there to connect patients with, so we will deep dive in the Google and search and try to connect patients with all the different programs that are out there.
And I was reading a little bit about you, and you're very impressive. I saw that you had helped this program come from 16 patients to over 80. Can you talk about how you've been able to do that and what kind of impact it's had on you?
Yeah, so I feel like the program has grown simply because we've been able to communicate better with our residents. One of the main barriers we see is transportation. So trying to connect with the patients while they're already in clinic is a very large part of just expanding the program. Is simply getting the patient in the building and being able to work with them to be set up with the program. And I feel like that's how it's been able to grow. It's just catching patients while they're already here, getting them to fill out the paperwork, and just being set up with it. So just promoting it and letting them know that there are options here to help you save money on your medications.
Yeah, and you partner with pharmaceutical companies, correct?
Yes.
What does that partnership look like?
Yeah, so we partner with several different pharmaceutical companies to help patients submit applications. Some of the most prevalent or common ones we work with are Sanofi and Novo Nordisk, and it's really just, communicating with companies and acting as a liaison for the patients who might not have access to internet. It might just be something as simple as that, but they might not be able to apply otherwise. So just working on behalf of the patient to communicate with the company's representatives and trying to get as many approvals as we can. And the program can be for totally uninsured patients or even underinsured patients, so they can have insurance and still apply for the program. I would say we've had pretty good luck getting patients who are insured get approved for programs. So yes.
And how have you seen this program completely transform patients when they can suddenly afford the medication that they need?
Yeah, so if they're approved for patient assistance programs, it's typically 100% free. They're typically approved for 1 calendar year, and then at that point we'll re-enroll them if they're needing to be re-enrolled. And I feel like, doctors prescribe these medications for a reason, so if they're able to actually access the medication and take it like their plan of care is, then that's just going to make their health better overall. And it's typically that patients are not necessarily non-compliant with their plan of care. They might not have access to the medication. So with these programs, I feel like it helps patients take their medication as they're supposed to, and in turn have better health outcomes.
I mean, access seems to be a big issue throughout the state of Alabama.
for
Do you
sure.
think that this is a broader like healthcare affordability issue that we're seeing?
I would think so. I mean, it's just pharmaceutical companies, it is very expensive for patients to afford their medications, and across the board, drugs are very expensive, and it seems to be increasingly so. So if we can eliminate the cost of those medications for patients through these programs, we of course want to do that for them.
And how can people watching access this program?
Yeah, so they can visit us at our social work intake office, and we can review their list of medications with them and try to pick out if there is programs for any of their medications. And we will do the application with them and follow up with them through that entire process, and also keep track of their enrollment. We try to help patients not have any gap in care, whether it be the expiration dates or refills and things like that. So they can come to our office and we will help them get connected if there is a program for any of their medications. And if not, we will try to outsource it to local agencies who might be able to help pay for some of those prescriptions.
Well, thank you for being here. That's all
Yes,
for
of
our
course.
discussion
Thank
today.
you.